This video focuses on nursing assessment of the abdomen. While the setting and situation involve an emergency assessment, the techniques covered are useful to understanding abdominal assessment across patient scenarios. Viewing this topic will enhance your ability to identify common and concerning symptoms related to the abdomen, employ appropriate interviewing and techniques of therapeutic communication as you gather subjective data about this body system, perform both a full and an emergency physical assessment of the abdomen, understand normal findings as you assess, and document and communicate findings from this regional assessment clearly and accurately. The abdomen is the part of the body between the sternum and the pelvis. For purposes of examination, the abdomen is divided into quadrants determined by lines drawn vertically between the xiphoid process and the pubic symphysis, and horizontally through the umbilicus, resulting in right upper, right lower, and left upper quadrants. The abdomen includes several body systems: gastrointestinal, female reproductive, lymphatic, and urinary, as well as various organs and structures including the kidneys, small and large intestines, appendix, stomach, gallbladder, liver, spleen, pancreas, and bladder. These viscera are divided into solid viscera, which typically maintain their shape, and hollow viscera, which tend to change shape depending on their contents. Common and concerning problems of the abdomen include signs such as lesions and rashes, scars, vigorous pulsations, masses, bulges, or protrusions, hypoactive or hyperactive bowel sounds, abnormal tympany, resonance or dullness, and organ enlargement. Symptoms include one or more types of pain described as dull or aching, burning or gnawing, colicky, sharp or knife-like, variable, and pressure. Other symptoms include nausea, vomiting, change in appetite, change in elimination, and change in skin color.
It is important to ask your client about each of these symptoms. Whenever the client indicates a positive response, use effective communication techniques to gather more detailed information. Mr. Lafoy is a man in his late 30s presenting to the emergency department today with moderate abdominal pain. His nurse will need to elicit crucial information quickly, so she will shape her subjective data collection appropriately, employing active listening skills in conjunction with closed and open-ended questioning techniques. If possible, start your interview by establishing rapport and calming your client. Introduce yourself and explain why you are conducting the interview.
So, Mr. Lafoy, what brings you to the emergency department today?
My stomach hurts.
I'm sorry to hear that. We're going to see what we can do to help you feel better. First, I'm going to ask you some questions to help us establish the cause of your pain. Some of my questions may seem very personal, but they're important. Your answers will help us to better understand what's going on with your abdomen. After that, I'll conduct a physical examination, okay?
Okay.
By obtaining a history of present illness that explores the features or variables of the specific reason for seeking care, along with related symptoms, you will better understand the client's perspective and be able to provide a detailed record of his experience as care progresses.
Mr. Lafoy, describe your pain for me.
Well, it's my stomach. It started just as a few cramps, but it's getting worse.
When did the pain start?
About 3 days ago.
Can you show me where it hurts?
Well, it hurts all over, but it's definitely worse on the lower left side.
Is it continuous or occasional?
At first it was off and on, but since yesterday, it's more frequent and worse.
On a scale of 0 to 10, with 0 being no pain and 10 being the worst possible pain, how would you rank your abdominal pain?
At first it was probably like a 2, but now it's more like a 5 or 6.
Does anything make your pain worse?
Not really. I just can't get comfortable.
Have you had any diarrhea in the past week?
Yeah, at least 5 times just today.
And when did that start?
Also about 3 days ago.
Is your stool bloody, or does it have mucus in it?
No.
Does anything make your pain feel better?
Yeah, I mean, when I have a bowel movement, it feels better for a few minutes, but then the cramps start all over again.
Have you taken any medication for the pain or diarrhea?
Well, I took ibuprofen for the cramps, but it really didn't help any.
Okay. Anything for the diarrhea?
No. I mean, I really wouldn't know what to take for that anyway.
Okay. Is anything else going on? Is anything else bothering you?
Well, yeah, I've started to feel nauseous. In fact, I tried to eat something this morning and I threw it right back up.
Any blood in your vomit?
No.
Mr. LaFoy, you're doing great. Hang in there for just a few more questions, okay? Tell me about your diet. What kinds of foods do you usually eat?
I try to eat healthy, you know, vegetables, fruits, yeah, fish. But, you know, lately I've been really busy traveling in the car a lot, so I started to eat a lot of fast food.
And how long have you been doing that?
Probably since last Monday.
So a little over a week then?
Yeah, that's right.
When's the last time you urinated?
I don't remember. Early this morning. I can't really say for sure.
Any fever?
I don't think so, but I haven't taken my temperature.
Have you had any chills or sweats?
Yeah, I've definitely had chills. I just can't seem to get warm.
Are you warm enough now?
Yeah, I'm okay right now, thanks.
Mr. LaFoy, have you ever had abdominal surgery?
No, never.
3 of the most common sources of problems in the gastrointestinal region include colorectal cancer, foodborne illness, and gastroesophageal reflux. So the nurse makes sure to ask questions related to each of these.
Mr. LaFoy, have you ever been screened for colorectal cancer?
No, I don't think so. But I did have a full checkup a few months ago.
You say you haven't had any blood in your diarrhea?
No.
Have you had any recent episodes of rectal bleeding in the past months or weeks?
No.
Okay. You say you've been traveling in your car a lot over the past weeks or so, eating in a lot of fast food restaurants. Is that correct?
Yeah, that's right.
Okay. And do you live at home with anyone else? And if so, have they been experiencing any similar symptoms?
No, I live alone.
Okay, so to recap a bit, you've been traveling a lot for the past 8 or 9 days, eating lots of fast food. And for about 3 days now, you've been experiencing a cramping pain in your lower abdomen, along with diarrhea, and both have been getting more frequent and severe. This morning, you actually vomited, and you don't recall the last time you urinated.
Yeah, that sounds right.
Okay, Mr. LaFoy, let's get you into a gown so we can have a closer look.
During a routine visit, you would inquire more deeply into the client's past health history, and also inquire about family history, lifestyle, and risk factors. In an emergency encounter, however, these questions will typically be postponed until later. In emergency cases such as this one, it is important to focus questioning on the client's reason for seeking care so as to progress to the physical assessment quickly. After all, vomiting and diarrhea can lead to severe dehydration, which, along with acute abdominal pain, can be potentially life-threatening. Even in an emergency situation, of course, make sure to carefully note the client's answers so that you can thoroughly document your subjective findings at the earliest opportunity. After interviewing to obtain subjective data, conduct your physical examination to obtain objective data.
For learning purposes, this video will demonstrate an emergency physical examination of the abdomen. In an actual emergency encounter, you would likely use only a subset of these techniques, while during a routine visit, you might employ a more comprehensive set of techniques, depending on the client's chief concern, the healthcare setting, or other parameters. Nurses may also find it useful to conduct portions of the physical assessment at the same time as the interview, rather than conducting these tasks separately. Your physical assessment will generally involve inspection, auscultation, percussion, and palpation. Caution: when assessing the abdomen, remember to auscultate prior to percussion and palpation, because physical stimulation of the bowel tends to distort the quality of bowel sounds.
Palpation and percussion comprise a major portion of the abdominal assessment. So after performing hand hygiene, warm your hands. This promotes client comfort and relaxation, and also helps to minimize the client's sensations of ticklishness.
The following tools and supplies are generally used when examining the abdomen: examination gown and drape, tangential lighting source, stethoscope, and pillows to support the client's head and for placement beneath the knees to help relax the abdominal muscles.
Prior to beginning your physical assessment, ask your client to empty his bladder, as bladder distension may interfere with your assessment. Have the client lie supine, with arms resting at his sides or folded across the chest. Support his head with a pillow for comfort, and support his knees in order to relax the abdominal muscles.
Next, I'm going to pull back your gown just enough so I can expose your abdomen and examine it. Okay?
Okay.
To respect client privacy, gather the gown and arrange draping carefully, exposing only the area that you are examining. When assessing the abdomen, visualization of the client is required from the sternum down to the groin area. Tangential lighting can often help you to more clearly identify abnormalities such as bulges, pulsations, masses, or discoloration.
I need you to relax, so try to breathe deeply and slowly through your mouth, okay?
Begin with inspection, first observing the coloration of the skin. Typically, the abdomen is paler than extremities because of reduced exposure to the sun. Observe also the skin's vascularity and look for striae, scars, lesions, and rashes.
No vascularity, striae, scars, lesions, or rashes.
Note also the abdominal contour and symmetry, observing at eye level, from the side.
Raise your head for me, please.
From behind the client's head.
Raise your head for me, please.
And from the foot of the exam table.
Raise your head again for me, please.
Normally, the abdomen should not bulge.
The abdomen is flat with good musculature, no masses or bulges.
Continue observing as the client breathes. Look for abdominal movement, aortic pulsations, and peristaltic waves.
No abdominal movement, aortic pulsations, or peristaltic waves.
Next, warm the diaphragm of your stethoscope. Then use it to auscultate for bowel sounds.
Caution: when auscultating, percussing, or palpating a tender abdomen, always start in the quadrant farthest from the pain.
In this case, the nurse begins in the right upper quadrant, then proceeds clockwise to the left upper quadrant, the right lower quadrant, and the left lower quadrant, listening for at least 30 seconds per quadrant. Bowel sounds normally occur every 5 to 15 seconds, roughly equivalent to one sound per breath. Note the intensity, pitch, and frequency of the sounds. Listen for at least 60 seconds when verifying the absence of bowel sounds.
Bowel sounds are hyperactive in all 4 quadrants.
Next, switch to the bell of the stethoscope and auscultate for vascular sounds, listening for bruits over the abdominal aorta, then both renal arteries, the iliac arteries, and the femoral arteries.
No bruits heard.
Continuing with the bell, listen for a venous hum in the epigastric and umbilical areas.
No venous hum is heard.
Finally, switch back to the diaphragm and listen for a friction rub over the liver and spleen.
No friction rubs heard.
After auscultation, you may safely percuss the 4 quadrants, following either a clockwise sequence or an up and down sequence.
tympany over all 4 quadrants, dullness over liver and spleen.
Next, proceed with palpation, beginning with light palpation to assess for tenderness and guarding. Then palpate deeply in all 4 quadrants, assessing for subtle masses and to delineate the abdominal organs. The client may normally feel mild tenderness during deep palpation.
If you detect any masses, as distinct from normally palpable organs and structures, be sure to note their location, shape, size, consistency, and mobility.
Abdomen is soft with diffuse tenderness on palpation. No guarding, no palpable masses present.
Next, palpate deeply in the area of the umbilicus, assessing for swellings, bulges, or masses. Then palpate the aorta by palpating deeply in the epigastrum, slightly left of midline. If palpable, assess the aorta's pulsation. In clients older than 50, also note the width of the aorta.
Caution: never palpate a pulsating midline mass because this may indicate a dissecting aneurysm, and the pressure of your palpation may lead to a life-threatening rupture.
Width is approximately 2.5 centimeters. Pulsation is strong and regular without tenderness.
Next, attempt to palpate the liver, which is usually non-palpable, noting consistency and tenderness. First, palpate bimanually.
Now take another deep breath for me, please.
Then palpate by hooking.
Now exhale. Liver edge is smooth, no tenderness.
Next, palpate the spleen. Palpation may be performed with the client supine or on his right lateral side.
Okay, take another deep breath for me, please. Now exhale.
Then palpate the kidneys.
Another deep breath for me, please. Okay, exhale slowly. Now hold it. Okay, you can breathe now. And we're going to do the same thing for your other kidney. Another deep breath for me, please. Exhale slowly. Now hold it. Very good. Spleen and kidneys non-palpable, non-tender.
The kidneys are difficult to palpate, so employ a technique called blunt percussion when assessing these organs for tenderness. First, move the client to a sitting position. Then perform blunt percussion on the kidney. Reposition yourself if necessary and repeat the procedure over each kidney at the costovertebral angle over the 12th rib.
No costovertebral tenderness noted.
After completing your objective data collection, document both positive and negative findings, using the correct phrasing of findings as demonstrated during the assessment. Mr. Lafoy's emergency assessment findings are consistent with an infectious diarrhea and dehydration. The nurse will consult with her client's primary care provider, who will initiate appropriate diagnostic tests and therapeutics. If this encounter entailed a non-emergency assessment, the nurse would take the time to review with her client ongoing health promotion measures and to suggest measures to promote and maintain the client's gastrointestinal health through proper diet, exercise, and regular examinations appropriate for Mr. Lafoy's age and gender.